wish I could tell you that was my one story about that one time I saw a child mutilated by bullets, or that time I cared for a family so hungry they came to the emergency department simply for food, or that one time where I couldn't discharge a child home simply because there was no home for them to go to. See, it's not just one story, and it's just one time. There's just far too many to count.
And COVID-19 is just exposing how broken our healthcare system is. I remember at the beginning of the pandemic, we had patients desperately asking to be tested. My response, I just didn't have any tests to send. I remember one patient asked me, well, doctor, how is that fair? I just saw the entire Brooklyn Nets got tested 2 days ago. I didn't know what to say.
This spring, as the coronavirus pandemic heated up, I began to wonder what would happen with Wisconsin's spring primary. It never occurred to me that our state would actually risk people's health by holding an in-person election during a pandemic, particularly when safer alternatives were available.
COVID-19 has made it harder to vote in safe and healthy ways, particularly in communities of color where we see those most impacted by failed healthcare policy.
And that's not why I went into medicine. That's not why I became a pediatrician. I didn't do this to experience countless stories of how policy continues to fail children, particularly children of color.
But providers like me, we can do something small but powerful, to ensure that our colleagues and our patients have a seat at the table.
We've created the Healthy Democracy Kit to help you do exactly that. The Healthy Democracy Kit consists of a Vot-ER lanyard and badge backer that you can make a part of your regular ID cards. The badge backer that you will receive displays a QR code along with a text code that will direct patients to a nonpartisan online voter registration portal that's specific to their state of residence.
In our Vot-ER Healthy Democracy work, we have a few core beliefs. We believe that empowered voices in communities lead to positive health outcomes. We believe that by voting for our health, we can preserve what works or demand change for the things that don't. We believe that our healthcare system is stronger when we, as providers and as patients, all show up.
Doctor, what's that badge?
This badge allows you to register to vote on your own phone. All you have to do is shoot your phone at this QR code or send this text message to this number, and the platform walks you through all the steps to get registered to vote or request your mail-in ballot in 90 seconds. I gotta go see another patient, but the platform will walk you through the rest. Okay.
Of course I'll register to vote, but who are you voting for?
I'm voting for you and your health.
With all that's going on with COVID, I really want to make sure that you can vote in the safest and healthiest way possible. And the best way to do that would be to vote from home. I can help get your vote from home ballot while you're here in my office today.
Every time I feel like it's Groundhog Day, from now on, I'll ask my next patient, are you ready to vote?
As healthcare providers, we cannot tear down these barriers to equity by any one prescription or procedure. We know the limits of our reach. We also know the power of a vote.
Watching all of the drama surrounding this election unfold made clear that we must begin preparing for the November election now.
So vote.
Vote.
Vote like our health depends on it.
Vote like our health depends on it.